Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So today we're playing some different roles here. Brad's playing the patient because he is the patient.
Believe me, I'm not playing.
So the title is Patient Brad with neck pain from turning, when he turns, receives mobilizations by Bob,
Yeah.
from me.
Yeah, so this is what we actually do in the clinic, and you get to see how it really works.
Yeah, we're going to show you how it goes, and we're going to show you something you can do to yourself if it works and feels fine.
Right.
So give you options of something you could try in your own home.
Right.
So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. I guess that the giveaway is going to be probably the bands, right? Yeah, okay.
Well, they'll show you.
Go to bobandbrad.com, go to the giveaway section. Whatever we're giving away, it'll be there. It's probably the exercise bands. You can also find it on Facebook. It'll be pinned to the top of the page. Twitter, Instagram, or TikTok if you want a 60-second version of the program.
Once again, a highly rehearsed intro.
Here we go. All right, I'm here with a difficult patient. So Brad Heineck, who we get injured all the time too, or get hurt and develop issues that we didn't see coming. So Brad woke up last night, right? Or no, it showed up yesterday already.
Yeah, well, I know what I did because I did something I shouldn't have did as far as posture thing. But anyways, last night I woke up with neck pain so bad that I couldn't lift my head off the pillow unless I grabbed my hair and pulled it. So I adjusted pillows, blah, 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 went out to the couch, see if I could get better there, nothing there. I went to the recliner. Finally, I could find a position I could sleep in for a couple hours. Otherwise, I was not sleeping. So my symptoms are pain, left side of the neck, up at the hairline.
Right up at the hairline, right at the base of this. The
hurts to bend down like that. It hurts to bend over to pick something up. It hurts to go to the right that far, and it hurts right there to go to the left. So Bob's going to do what we call a mobilization on the upper cervical vertebrae, and he can get into the details.
Yeah. So we're going to see.
I'm going to take my mic off now because it gets in the way.
A lot of your rotation occurs at the upper level of like C1 and C2, and we'll show that. I'm going to go ahead and push on the lateral bone there. So I'll show on the spine after this, Brad, okay? All right. You want to go ahead? I'm going to put a little pressure. Is that all right?
Yeah, should feel good.
Okay, now turn to the right. So I'm helping with the accessory movement, basically. Why don't you back up again, Brad? Bring it back again. Are you okay so far? Yeah. So you see he's going farther already. Come back again. Now, which I like to stop usually after 3 just to see how you're doing. You're doing okay? All right, this time now, I want to push. I'm going to have you do a little overpressure with your hand. Okay? Brad's saying it feels pretty good. And you can see it's actually going further. Well, we do 2 more, and then we'll stop. Okay, and why don't you give it one more, little overpressure again? Good. Now, he can do these himself. He can take his finger and grab that spot and apply pressure and then do turns with that, like that. And I'll show you on the spine what we're doing here. So here is C1, and look how it has this big wing that comes out there. That's what I got my thumb on. I got my thumb and finger right on that bone that sticks out there, and I'm helping it move along and get movement there. Sometimes it seems like this bone almost gets stuck to the one below it, and so they're all turning, and it hurts to turn because it's going further than it should. It's not getting any help from this bone. So I actually am pushing right here on that bone and helping it turn.
So that's called a mobilization in the therapy world.
But you can take your own finger and put it on there, and as long as it's pain-free, you can go ahead and do the movement.
Yeah.
And there's nothing wrong with doing this. I mean, of trying it. So if you wake up with a stiff neck, it's something you can
Are we
certainly
going to try the other direction?
If you want, we can.
Well, let's see what happens because that direction actually was a little more painful to go before. So I'm curious.
Was it on all the pain on this side though? Okay, so we actually should keep the thumb on this side then, believe it or not. So I'm going to put this here. Okay. I'm going to put it a little higher maybe. Right there. Okay, now good posture. And now turn to the left. That okay? So again, we think it's stuck on the left side. So that's why even though I'm going to he's going to the left, you'd think that you want to do the bone on the right, but you actually stick with the one on the left. We'll just do a couple more. I don't know if there's a magic number here, but look at that. There you go. Starting to look like a normal neck. And we'll leave it at that. If you're getting some pain and with turning, this is something you can try, but again, it should be pain-free. Otherwise, I wouldn't do it. Sure. Brad says he's going to try it without anything now, and you can see he's moving better. He's still stiff, but moving a lot better. Oh, he said to the left is much better. So.